and today's tips and tools will be about opiate detox. I have with me here in studio Dr. Rafael Penunuri, board certified in addiction medicine. He will explain why self-detoxing does not work. Thank you, Dr. Penunuri. Please explain to our viewers what it does not work.
Well, people are addicted to opiates. Have to understand that addiction is very, very powerful. The types of patients that I see in the office are people that are trying to come off, who are trying to come off from opiates, are either taking lots of pain prescription medications like Vicodin or Percocet. Those are the pain pills, and others may be taking heroin, and heroin is a very, very powerful drug. What I see is that by the time I see them in my office, they've been on these medications for many months or many years. The average person that I see probably has been on these type of medications for about five years. And the idea of all of a sudden stopping the medication and trying to detox yourself off in a day or in a few days is not a very realistic idea, particularly when you compare one to 3 days compared to the 5 years you've been that people have been on it. So my recommendation, it's a very difficult detoxification. People call it cold. What people call that type of detoxing is cold turkey, and I really yet to see anybody that's been very successful at self-detoxing themselves. But the only people that I see that have self-detoxed themselves are the ones that have been in prison and have had no choice, and they say, well, I had to detox cold turkey, but that was a very, very difficult detox. It's like having the flu syndrome, but even worse. There's a lot of severe symptoms with this type of detox. As these severe, like you feel like a very severe flu is hitting your body with a lot of severe body aches. You're hurting all over from head to toe. You're having a lot of severe chills, a lot of sweats, a lot of anxiety, a lot of irritability, a lot of nausea, and sometimes some GI symptoms with abdominal pain, cramps, and vomiting and diarrhea. So there's a lot of severe symptoms, and people do try it, and once they get hit with this, it becomes so severe that they can't stand it anymore, and then they revert back to their medication, whether it's pain pills or heroin. So in this type of category, it's almost impossible. But I'm not going to say it's impossible. It's there are a few people that have roughed it out and have done well. But a week later or two, they're back on their narcotics. So So the type of people I see is, they've already tried. By the time I see them in the office, they already tried. And the reason they come to my office is because they need help, and that's what I'm trained to do. I'm trained to help them, and when I see them, then I can start them on a treatment program. But in general, if people were able to detox themselves on their own, there would be no need for them to come see me, and I wouldn't be seeing anybody. But from the number of patients that are coming to see me every day to help them out, it tells me that it's almost impossible. So I would not, I wouldn't recommend that you try to self-detox. I would recommend that you see a specialist that can help you. And there's a lot of medications out there that are very helpful, very, very useful, and it can be done in many different settings. It can be done as an outpatient, or as an inpatient. But that's another topic. But But my recommendation at this time is don't try to self-detox. Just come in, get the help that you need, and we'll be able to help you.
Fantastic. Thank you very much, Dr. Penunuri.
You're welcome.
So the next question here is, what are the best options for detox, and whether or not insurance perhaps covers it? So I would like to ask Dr. Penunuri to explain what these options are and what the insurance coverage perhaps would be, whether it is available, is it accepted form of detox, so that our viewers can learn more about this. Dr. Penunuri?
Sure, yeah. Well, from my experience, if you have insurance, insurance are willing to pay most of the options, and there's a lot of different options. The first option, which I explained, is self-detox. Try not to do that if you can't. If you have other options, and the next option would be really is outpatient. There's medication for the outpatient office. The outpatient detox can be done out of the hospital as an outpatient, thanks to the new medications that are available, such as Suboxone or buprenorphine. That's one option. So if you go to a physician who is certified to prescribe buprenorphine, he can help you with that type of detox. And insurances do cover it. It's basically an office visit, and they do cover the medication, the buprenorphine, or Suboxone is another name for it. It's covered by insurance. How much coverage they have? A lot of them cover it 100%, but most of them actually have a copay, whatever your copay is. So it's a great medication. So that means that you can get outpatient detox and still continue with your life. You can continue working. The other options are inpatient, and there's various forms of inpatient treatment for that. And that the one form is the hospital, inpatient hospital treatment, which can be done at various hospitals. The one I work with is Hoag Hospital, and they do a good job at it. The other option would be residential. You can have detoxification in a residential setting. The residential setting, there may be about 6 or less patients in that setting, so it's a little bit more comfortable. It'd be nicer beds in the hospital. You can detox there, and insurance do cover that as well. They'll cover the residential just as well as they'll cover hospital. So it all depends on your insurance too. Which residential treatments you can go to, because some of these insurance are contracted with certain residential facilities, and same thing with hospitals. Some of these insurance companies are contracted with certain hospitals. So you would have to first, decide what type of treatment you want. Do you want to do outpatient? Do you want to do inpatient hospital, or do you want to do inpatient residential? And once you decide which one you want to do, then you call that center, and that center will figure out whether your insurance will cover that. So there's usually an admissions counselor for the hospitals or for the residential treatment programs. The one I work with is at Atlanta Recovery Center, and we have a very knowledgeable person that will talk to you and take the information. And what they really do is they also screen you to make sure that you are a candidate for our programs. And then from there, he or she will verify your insurance. Will call up the insurance, find the information, and let you know what you need to cover. But there's a lot of variable options. The outpatient option is a good one, because then you can go on with your life. But some people need more specific monitoring. You may have medical problems that need to be monitored, whether you're having a problem with the diabetes or severe high blood pressure, or your blood pressure gets out of control if you're withdrawing too much. or you have problems with depression or some type of dual diagnosis problem, depression, bipolar disorder, anxiety, and if you have something like that, it's kind of hard to try to detox as an outpatient. You may want a little setting where there's more attention. There's nurses, there's counselors, so you get a lot more specialized treatment in those type of settings. But from my point of view, there's a lot of different options, and the idea is to try to direct you to whichever option will be best for you, for your family, and your loved ones. How you can, the idea is to get, the main idea is to get help. The main idea is to get treated, and whichever option you choose, or whichever option may be recommended. If you talk to a counselor, the counselor may recommend, well, you really need this because of you have depression, you have bipolar disorder, you need to be monitored a little bit more, and you need special counseling along the way. So those are the various options.
Thank you very much, Dr. Penunuri. So next, I would like to talk about the risks and benefits of medication-supported detox, specifically application of buprenorphine.
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona Del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.
This is Therapy Cable. It's our episode on tools and tips. And today's discussion about tools and tips on medication-supported detox with a focus on buprenorphine is brought to you by Dr. Rafael Penunuri, board certified in addiction medicine. This subject is very important, as a lot of people know about buprenorphine. They can even get it, unfortunately, not prescribed on the streets, and it can be a dangerous drug. It can also be a good drug, depending how it is applied and for what purpose, what duration. So those are important things that we would like to talk about. I'll ask Dr. Penunuri to explain the pros and cons of buprenorphine and what it is really good for.
Okay. Well, in general, there's few medications that we use with opiate detoxification. At this time, the major medication that we're using is buprenorphine. In the older days, or a few years ago, the main medication was methadone. So what's happening now is that buprenorphine is replacing methadone for opiate detoxification. Methadone is much more difficult to prescribe because it's only prescribed at certain methadone clinics, and those are more government-sponsored type of clinics, and it's very hard to go to those clinics, and you got to go there on a daily basis. But with buprenorphine, now you can get a prescription and you can go home and don't have to come to the office on a daily basis for your detoxification. What buprenorphine is actually is called a partial agonist, and what it is, it's a semi-synthetic opiate. And what I mean is that it has some of the properties of the regular opiate medications, and it also lacks some of these properties. There's one property that regular opiate medications or pain pills or heroin is it's called tolerance. And by tolerance, it means that after taking certain medication for a prolonged period of time, you require higher and higher doses to get the same effect. So I have patients that have started on Vicodin at 2 to 3 per day, and with the effects of tolerance, after a while their pain is not being relieved, and now they're up to 15 to 30 tablets per day. So they developed tolerance, and they really bumped up their dosage by 10 to 15 times more than from what they started off. So the good thing about buprenorphine is I don't really see any tolerance. We can start a patient on a certain dosage, whether it's 2 milligrams, 4 milligrams, or 8 milligrams per day. Then usually that will help suffice, and they really don't need to be bumping it up every week or every month or every year. They can stay at a constant dosage and they'll be fine. So I don't have to worry about that. So that's great. The other property, actually one property about buprenorphine is that it does have some pain relief. So it's actually a fairly decent pain medication. I would say it would work in the for pain that's more in the moderate degree. I wouldn't recommend it for severe pain, but it will help people with chronic pain. We have moderate pain, and a lot of people are on opiate medications because of chronic pain. So this is a great medication in the sense that, number one, it helps with pain, and two, it doesn't develop any tolerance as you take it, so you can stay on it and it'll help the pain. Now, the other property, one of the properties about buprenorphine, you can think of it as a semi-synthetic opiate, which has, let's say, 50% of the properties. So it kind of works like an opiate, but it's not. When it binds to the opiate receptor, the mu receptor, it binds to the receptor, but it kind of binds to the receptor very, very imperfectly. It's not a perfect bind, even though it has a very strong, it binds to the receptor very strong. It has a very, what I call a very high affinity for that receptor. It'll bind really tight to that receptor. And what it does, if there's any other medication, heroin or oxycodone attached to the receptor, if you give it too soon, that buprenorphine will bind to the receptor and it'll actually kick out the other opiates. Just like that, just boom, it binds to the receptor, it kicks it out, and that's a problem. And if what it does, if it kicks out too fast, then anything that's getting kicked out too fast will cause withdrawal symptoms. So one of the things I tell my patients is when you first take the medications, make sure that you have not taken medication. If you're not taking your pain pill for at least, I would wait 12 hours after your last dose of pain or a pill or your last dose of heroin that you took. Wait at least 12 hours. By that time, it's fairly safe. By that time, most of those opiates will be out of the receptor, and then the buprenorphine can actually bind to that receptor and not cause any further withdrawals. And by that time, you'll be fine. And actually, you may, if you wait 12 hours, yes, by 12 hours, I expect you to have the patient have some withdrawals. You might have some body aches, some chills, some sweats, a little nausea, a little runny nose, a little yawning. Those are some of the withdrawal symptoms. But if you're having that and you take the buprenorphine, it'll eliminate those. And but that's a property of buprenorphine. It's very high binding. Now the other consideration about the buprenorphine is that it's still an opiate. Like I said, it's considered like a 50% opiate. It's like but a very imperfect opiate. But so it's a weak opiate, And what happens with any kind of opiate is that high doses and for a prolonged period of time, then you can get addicted to it. You develop dependency or a physical addiction. And this physical addiction, if you try to cut yourself off that, if you've been on it for a long time, the buprenorphine, then you'll have some withdrawal symptoms as well, and then we're back to where we started. so that can be problematic. It depends what your dosage is. If you're on high doses, if you've been at the 16, some people are taking 16 milligrams per day, which is I consider a little bit high. And if you've been taking that for 2 or 3 years, then it's something you don't want to all of a sudden stop taking. You want it. You want to slowly wean yourself off it, and that's another topic. But one of the things when I first start a patient on this medication, I have to. One of the things I have to explain to them that they can also get addicted to that. If I don't explain that to my patients, I'm not doing my job. Okay, so that's very, very important. So now that you have this knowledge, then the question is, how do we use this medication in detoxification? Okay, and when you come in, we're going to just do a detox, and basically our detox will be anywhere from 1 to 2 weeks. We can detox you off medications, off the prescription pills or off the heroin, or we can do maintenance. Okay, so there's 2 ways of using it. One for detoxification, the other one's for maintenance. Now maintenance is another animal. Okay, and the maintenance is what kind of patients do we do the maintenance on, and it's all variable. So that's actually a very difficult decision to make, and who we're going to start the maintenance and who not. If you're the person that I just want to get off all drugs, now I just want to be 100% clean. Let's do the plain detox and let's see how that works. Well, we'll detox you in the week. Within 1 to 2 weeks, we can detox you with buprenorphine, and if you're not a heavy user, then I think you'll be fine. But if you're a person that has been using for 5 years, using IV heroin or smoking heroin or any of those hardcore drugs, then it's going to be a lot tougher. Okay, we can do a detox, but yes, the problem after the detox, then there's a problem with cravings, and if you have a lot of high cravings, then you're going to relapse. Okay, so we use a maintenance to help prevent relapse. So that's the whole key. Why detox you if you're going to relapse again? We don't want to do that. So we want to be able to maintain you in the sense that you're not relapsing, that you're not going through your old habits. And so one of the things that we need to do is we have to decide on your maintenance dosage and whether you're a candidate for that. But I'd say the heavier the higher degree of usage that you have in your life of any type of opiate, if you're using high doses of prescription pills, or if you're using heroin, then the chances that you'll relapse are great. So in that case, I would recommend that you go on a maintenance program. And but there's other aspects to this. There's detox, there's maintenance, but then if you're a high relapser, then I recommend some counseling too. You need to be a counselor, get some treatment, do maybe an ILP program, along with this detox. But that's another issue. There's detox, and what do we do after detox? But one of the as far as pharmacology wise, maintenance would be one. That's the treatment. Maintenance with buprenorphine would be highly recommended.
Very good. Thank you for this great explanation, Dr. P. I say Dr. P. Dr. Penunuri.
Yeah.
And this is a very complex issue. A lot of people hear about medication-supported detox, if you will, as well as medication-supported maintenance. But they don't know the difference between these. When is it called for? What are the pros and cons? Why does it work? And rather than, going by hearsay and assumptions and just kind of myths, we want to shed light on the specific details, medical perspective, scientific perspective, chemical perspective, the nature of things, how and why things work and in what fashion. As always, you would want to consult with a professional rather than doing this on your own. However, at least educating yourself about the nature of medication is important, as well as when it is good to use them and when it is better not to use medication. And always consult with either a psychiatrist if it is about psychotropic medication or just general MD, especially if a person is specializing in addiction medicine like yourself, then consult with someone who is specializing in that area if you're struggling with addiction of this sort, substance use, if you will, or prescription medication. The issue of buprenorphine or Suboxone, as you mentioned, is very prevalent, and a lot of people talk about this, and it's good to know the details of this. This is a very complex phenomenon. You mentioned a lot of these, especially why would you want to do detox if you already know that there is danger or risk for relapse based on history and usage and dosage, etc. So maybe you're better off actually planning a long-term maintenance. What would you say if a person would want to get off of this on a long term, but they opt to do a maintenance in the short term? Is that something that you would consider?
Yes, I think it's very good. I think that the chance of relapsing in the first 3 months is very great. So I would recommend a short 3-month maintenance program, and then slowly kind of wean you off towards the end.
Towards the end, okay.
And a slow taper, and that way it won't disrupt the patient's life.
Very good. And also, I would recommend to seek therapy, psychotherapy, throughout this process,
Exactly.
To really deal with the underlying issues. As Dr. Penunuri mentioned, a lot of times people come in with not only an addiction problem or symptom, that they're struggling with this dependence or tolerance or withdrawal with substances, but also they may be depressed, they may be highly anxious, they may have relational problems, individual problems in terms of, let's say, not being able to concentrate or achieve their goals, or feelings of maybe failure or other types of emotionally intense situations. So therefore, if you also seek psychotherapy, talk to a therapist, a counselor, a psychologist, a psychiatrist at the same time, then you can really delve within this issue much deeper and kind of get to the roots of it and completely eradicate that problem from your life. So thank you very much, Dr. Penunuri, for joining us on another Therapy Cable Tips and Tools. And we look forward to creating more tips and tools for you and posting it to our website. Thank you very much and have a good day.